I was studying a particular topic today in internal medicine, and I realized how common this particular issue is. And from my experience, it is more common in older adults. Then I remembered that more than 50% of my subscribers are adults in their 50s, and I felt like doing a video on it. So I have a question for you guys. Have you ever looked down at your legs or ankles at the end of the day and thought, "Whoa, where did all that swelling come from?" Maybe you've been sitting a bit too long, or you just finished a busy day and noticed things feeling tight and uncomfortable. Sound familiar? Well, here's the thing. Swelling in the legs and ankles can happen for so many reasons, and yeah, sometimes it's harmless. But especially as we get older, it can be a little signal from our body saying, "Hey, pay attention!" In this video, we're diving deep into what swollen legs and ankles mean in older age, why it happens, the causes and risk factors, and how to relieve it naturally with simple, practical steps. I'll also cover when it's best to check in with your doctor just to keep things safe. So if you're curious about what's really going on and what you can do about it, stick around. Let's get right into it. Do not pay too much attention to the visuals, as I do not have enough resources to represent my thoughts with the visuals. Just pay attention to the message I am trying to pass here, and you might save yourself from lots of issues. So, what does it actually mean when you notice that your legs or ankles are starting to swell, especially as you get older? Well, here's the scoop. As we age, our body goes through some changes that might not always be obvious on the outside. For instance, our veins and blood vessels, these tiny, hard-working channels that keep blood flowing, can start to lose a bit of their elasticity. They might not be as strong or efficient at pushing blood back up to the heart as they were when we were younger. And when that blood doesn't flow as smoothly, guess what? Fluid starts to build up in the legs and ankles, causing that uncomfortable swelling. Now, it's not just age alone. Aging also brings a few extra risk factors into play. Conditions like high blood pressure, diabetes, and kidney issues can add strain on our circulation. Plus, if you're spending long hours sitting or standing, the blood can pool in your lower legs, leading to even more swelling. But here's the key takeaway. Swelling in the legs isn't always just a part of aging. It's often a sign that something deeper could be going on. And knowing this helps us take it seriously and keep a closer eye on our health as we age. Next up, let's talk about the main causes of this swelling and what specific risk factors might be at play. This will help you understand what's behind the swelling and what you can do to reduce it naturally. Alright, let's talk about the main causes and risk factors that can lead to swollen legs and ankles as we age. Understanding these can give us some real insight into what might be triggering this swelling and how to manage it. So, first up, circulation. As we mentioned, our veins work hard to move blood from the legs back up to the heart. Over time, though, the veins can weaken and lose some of their strength, which leads to something called venous insufficiency. That's a fancy term for when your veins struggle to pump blood efficiently, causing fluid to pool in the lower legs and ankles. This pooling is a major reason behind that swelling. Now, let's talk about health conditions that can make this worse. If you're dealing with high blood pressure, diabetes, or kidney issues, these can put extra strain on your circulation and fluid balance, causing even more swelling. People with heart conditions might notice this as well because when the heart isn't pumping as strongly, fluid can back up in the legs. Medications can be another sneaky factor. Some medications, especially those for blood pressure or pain, might cause your body to retain fluid, which can add to that swollen feeling in the legs and ankles. And don't forget lifestyle habits. Sitting or standing for long periods, eating salty foods, or not staying hydrated can all make a difference. Even small daily habits can add up. So now that we understand what can cause this swelling, let's talk about why it's so important not to ignore it. Next, we'll cover the potential complications if this goes unchecked and how they can impact your health long-term. Alright, so why does this really matter? What happens if we just ignore this kind of swelling and hope it goes away on its own? Here's the thing. While a bit of swelling after a long day can be normal, chronic swelling, especially in the legs and ankles, can lead to some serious complications if it's not addressed. For starters, the longer that fluid stays in your legs, the more it can stretch out your skin, and that actually makes your skin weaker and more vulnerable to infections. This is why some people develop skin infections or ulcers, open sores that are painful and can be tough to heal. Another big concern? Blood clots. If your legs are swelling regularly, it could be a sign of a condition called deep vein thrombosis or DVT. This is when a blood clot forms deep in a vein, usually in the leg, and it can be life-threatening if it travels to the lungs. And here's a complication many people don't realize. Swollen legs can sometimes indicate issues with the heart, kidneys, or liver. Each of these organs plays a role in fluid balance, and if any of them aren't working as they should, you'll often see that reflected in your legs and ankles. So it's definitely something to take seriously. But don't worry, I am not leaving you hanging. Up next, I'll take you through a step-by-step guide to relieve that swelling naturally with some simple practical solutions you can try right at home. Okay, let's get into the part you've been waiting for, the step-by-step guide to relieve that swelling naturally. These are simple, doable steps you can start right now to help reduce that fluid buildup and feel more comfortable. Step 1. Elevate your legs. One of the best and easiest ways to relieve swelling is to elevate your legs. Just grab a couple of pillows, prop your feet up, and try to keep them above heart level. This helps encourage the fluid to drain back up and reduces that heavy feeling in your legs. If you can do this for 15 to 20 minutes a few times a day, it can make a huge difference. Step 2. Get moving with gentle exercises. When we move, our muscles help push blood and fluid through the body. So if you're sitting or standing for a long time, take a quick break and walk around for a few minutes. Simple exercises like ankle pumps, just pointing and flexing your toes, can boost circulation in the legs. Even a short, gentle walk can help get things moving. Step 3. Watch your salt and stay hydrated. Salt can make the body hold on to water, which can worsen swelling, especially if you're not drinking enough water. So try to limit your salt intake and keep yourself hydrated. Funny enough, drinking more water can actually help flush out extra fluid in your body and reduce swelling. Step 4. Consider compression stockings. Compression stockings are a great way to support your veins and improve circulation in the legs. They come in different levels of tightness, so you might want to start with a light compression and see how it feels. They're especially useful if you need to sit or stand for long periods. Step 5. Natural remedies. Now, if you're a fan of natural remedies, some herbs like dandelion or parsley can act as gentle diuretics, helping your body release excess fluid. Just remember, if you're on other medications, talk to your doctor first before adding anything new. And there you go. These small, consistent changes can really help you manage that swelling. But remember, if the swelling doesn't improve, or you notice any sudden pain, redness, or changes in just one leg, that's when it's time to check in with a doctor. In fact, let's talk about exactly when you should reach out for professional help. Now, let's talk about those moments when it's best to reach out to a doctor. Because while these natural steps can help, there are times when swelling in the legs and ankles might be pointing to something more serious. Here's what to look out for. If you notice that the swelling is just in one leg and not the other, or if there's sudden pain, warmth, or redness, it's a good idea to get it checked out. These could be signs of a blood clot, which we talked about earlier, a condition that needs immediate attention. Also, if the swelling is consistent, or if it's getting worse despite trying some of these relief tips, it might mean that there's an underlying issue with your heart, kidneys, or liver that needs a doctor's input. And here's a simple rule. If something just doesn't feel right, or if you're feeling unsure, it's always better to be safe and check in with a healthcare professional. They can give you peace of mind and make sure everything's okay. So that's it. We've covered what swelling in the legs and ankles might mean, what can cause it, and some simple, effective ways to manage it naturally. I hope these tips help you feel more in control and give you some comfort. If you found this video helpful, please don't forget to like, share, and subscribe for more health tips like this one. Let's keep looking after our health together. Thanks for watching, and take care.